All right, good morning, everybody. I hope you can hear my voice clearly and you can see me as well. Thank you for joining me on a Sunday morning. And it's a very, very dark day. I mean, it's a very rainy day in Bombay. I don't know how it is in Hyderabad. Is it raining? Has the monsoon already begun in Hyderabad? Because it's been raining cats and dogs over here. It's cloudy. Okay. As you can see in Bombay, it's very, very dark and we've got to use our lights even in the daytime. It's almost as if it's evening. So, with the commencement of monsoon, let's hope that everything is fine. And with this short message, we'll start with today's session. Welcome to the webinar for today. I'm Dr. Mayur Dauda. I'm a dentist in Mumbai, and I work in a small place called Chembur. Currently, I'm the president of Dental Photography School. It's the only institute in India which is related to training and research with dental photography. I'm currently the director of The Dental Education. Now, The Dental Education is a platform. It's basically a website that provides a platform to the speakers and the attendees to uh, go through the webinars and attend live sessions, even if they are not a part of that place. For instance, you guys are in Hyderabad, and if I'm in Bombay, I'm giving a lecture. What The Dental Education does, it converts this lecture into a webinar and then it transmits it across the globe so that the people who are not in Bombay even they can attend. Currently, I'm also an artist. I do a lot of liquid droplet photography. My website is www.liquidcanvas.in. I'm currently the chairman of World Dental Photography League. Fortunately, I've been very lucky to be conducting a lot of art exhibitions. That's because of my passion for photography. Okay, Shrikant is telling that there was a good downpour last evening. As you can see outside, it's been raining really, really. I don't know if you can see, but it's probably because of excess light. It's been raining cats and dogs over here as well, Shrikant. So that's the situation in Mumbai. Okay, so coming back to the presentation, I've had a couple of art exhibitions. The biggest one of them was, of course, Kalagoda Art Exhibition. Apart from doing art exhibitions, I conduct art encouragement lectures in colleges and schools across India so that students take up photography seriously and it can become a passive source of income for them as well. I had a fair share of publications. Probably one of the biggest publications out of all of them was the cover shot on Better Photography magazine. For the people who know Better Photography magazine, I'm not too sure how many of you guys attending today have heard of BP. That's Better Photography magazine. Have you guys seen this magazine before? Anyone? Shrikant, you guys have heard of this magazine? No? Does not look like. Okay. Better Photography is probably the biggest photography magazine in India as of time. There are other magazines also. That's something called as Asian Photography, but to be completely Make in India photography magazine is only Better Photography. It is the biggest photography magazine in India at this point of time. I've had the privilege to be on the cover shot, and they had interviewed me in July 2014. That was last year. So I'm really glad to have been featured in this magazine. Touchwood, everything was great. For the people who have not heard of Better Photography, I'm sure you guys must have heard of Lonely Planet. Lonely Planet is currently the biggest travel magazine in the entire world. So I've had my fair share of publications in Lonely Planet magazine as well. I've been doing a lot of wildlife photography as such, but currently I'm doing only liquid droplet photography. The pictures in front of you, if you can see, these are all liquid droplets. This is my passion. I shoot liquid drops, basically collisions between two drops of liquid. These are called as liquid collisions. So if everything is great, I'll be seeing you soon, probably on 4th and 5th of the coming month. If we have got fair share of registrations for dental photography course over there. As of now, we'll be talking about how you can leverage photography so that you can raise your practice in dentistry. Let's see about today's webinar. So What is dental photography? Let's discuss that first. Okay. Do we have a question so far? Any questions? No. You can hear my voice clearly. I hope everything is fine. So let's discuss about what is dental photography. Basically, dental photography, anything in dentistry, if we take images of that, if it's a patient or if it's a case, if it's a model, if it's a prosthesis, if it's a treatment process, anything in dentistry, if we take a picture of that, it's called as dental photography. Now, dental photography is very, very important as of today because of medical legal reasons, of course. However, it's a very important step towards good documentation, and recording as of now has become very, very important as we are moving towards evidence-based practice. One reason which is not clearly understood by most of the dentists, which I feel when I deliver lectures across India, is that uh, you've got to understand that dental photography is the only means by which a patient understands you very, very clearly. And we'll come to this point as in when we proceed about today's lecture. You have to keep in mind that the only way by which we can actually speak to our patient very clearly so that they understand what we are talking about is dental photography. It's only because of the pictures that we show them that they understand what kind of treatment process we are planning for them or the ultimate result of whatever treatment we have done for them. It is only through the images. Personally, I suggest that we do dental photography in everyday dental practice. That's because life is full of surprises. Now, I'll put this question to the audience. Can you see something unique about this picture? If you can see something unique, you can just type it down. Let's see how many of you get this right. Anybody from the audience who can make out that it's something different from normal? Anything different from normal in this picture? Pits, okay, but there's something else which is unique. There's something different from normal Shrikant. What could it have been? Number of cusps, exactly. Yeah. So basically, of course, you can make out that this is a lower molar, and instead of having two cusps, it has got three cusps. It's basically got three cusps on both the sides. Although probably, I'm not too sure if you can appreciate that in the image, but uh, there are three cusps on both the sides, which is a unique feature of this patient. So photography gives us a lot more to live for in dentistry, and we can record all of these things. We can just keep it with ourselves, or probably we can share it for publications. Now, what happens with day-to-day photography is I feel that most of us are doing photography either by using a mobile phone camera or a point-and-shoot camera. Why that camera is not important, why we're not supposed to use that camera, we'll come to that. But if you understand this basic concept that if you take good images, you can actually share it with publication houses so that they can publish the image that you've taken. Now, this becomes an added source of glory for you as a dentist to be a part of this humble or noble profession. Why is dental photography important? Currently, as of today, I can think of not less than 50 applications of dental photography, which is why we are here today. We are encouraging dental photography in day-to-day practice. Internationally, it has been accepted worldwide. It is a part of the actual curriculum of the dental colleges across the globe. Unfortunately, in India, it is a part of the postgraduate curriculum only. And even in our colleges, even the postgraduates are not taught how photography has to be done properly, correctly, what are the different settings, what we've got to take care during photography, so on and henceforth. They are not even thought about the basic things like which camera to buy, which lens to buy, and stuff. This was the basic intention of the setting up of dental photography school in India. This is the exact reason why we have put up this institute. This institute is currently in Mumbai, but we give lectures across the length and breadth of India, especially in colleges, in dental colleges across India. Our lectures are completely free. So let's discuss a couple of uses of dental photography as of today. Can you think of a couple of uses? I've put forth a couple of uses in front of you. Some of them are documentation of our cases, marketing, shade selection, lab communication, communicating with the lab, scientific presentations. If you are planning to do paper presentations in India or abroad, good photography is absolutely important. Sharing the cases with your peers is of course very very important so that we can take their opinion. Apart from that, there are other reasons why we can take up dental photography. It's medical legal cases, forensics, forensic odontology is growing up big time. These are just a few uses of dental photography. Shrikant, can you name of any other use of dental photography, or any other delegate who is present today? Can you think of any other use? Yes, 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 exactly. Patient appreciation of before and after treatment. Exactly, very important, Shrikant. Apart from that, one of the reasons why dental photography is important as of today is because you are completely dependent upon you only. In fact, even if you make a website, say for tomorrow, you can put up your own images. You need not download images from the website. There's a good reason why you should be doing dental photography daily. And today you will understand how you can leverage dental photography to your convenience, or probably to make the patient appreciate what is the actual treatment plan, and how you can raise your practice, or probably convert the patients who are not willing to do treatment at your place to take up treatment at your place, so that you increase your profits as well. Like in any other branch of dentistry, there are a couple of important techniques in dental photography as well. The most important use of dental photography is probably in the first few appointments, when you see the patient for the first time. I personally feel that the first appointment with the patient, if you do dental photography in the first appointment, that patient is not going to go anywhere else, but it will come back to you only. Of course, as of today, there are so many dentists. We are facing a lot of competition from our peers. So how do we stand out in the crowd? So this is a question that has been faced by innumerable dentists across India as of now. Trust me on this, after today, you will not see that once a patient has come to you, they'll go to some other dentist, or even if they go to some other dentist, I'm sure if you follow what we are discussing today, they'll come back to you only. So be rest assured that after today, you will be doubling your profits no matter what happens. How? Let's discuss how. Now it's very clear that the patient is coming to you for some chief complaint. For instance, a patient is coming to you because if they have some pain in the lower right region, or if they have food lodgement, or some stuff like that. Now we all know that there has to be some problem over there. It can either be caries, it can be abscess formation in the bone, or probably it can be some gingival reasons, of course. But you've got to understand that you've been seeing all this since the time that you've begun your practice. Am I right? This is a norm for you. However, a patient is coming to you for the first time probably in his life. So he is not probably in the same wavelength. So when you are discussing the treatment plan with the patient, do you feel that they are in the same frequency that we are in? Do you actually think that the patient will understand the actual treatment planning protocol? Just imagine the differences between a dentist and a patient. Let's discuss that. What are the differences between the dentist and the patient? Now, just imagine that a patient has come to you. Let's just have a small discussion on the mindsets of both the people. This will give you a clear picture of why taking photographs is very important in the first appointment. Let's discuss about the dentist. Now, the dentist is very confident. He's sitting in his clinic. However, the patient is scared. The patient is not confident. The patient has come to you for some pain or some problem. So how can he be confident? He is of course scared. Let's go back to the dentist. The dentist has the entire knowledge of the treatment plan. Now he's seen the patient. He's done the differential diagnosis. Okay, he's thought about that there are so many cavities. Some of them need to go for root canal. But the patient does not know anything. The patient is waiting for an answer from the dentist. The patient is basically clueless, and the dentist has the entire knowledge. Now the dentist has 5 years or more of solid experience, especially in education, and the patient has no education of dentistry. So how can you speak to the patient directly? This is where we are lacking something behind. This is where we are lacking, because we are not putting ourselves at the place where the patient is. The patient is a newcomer to us. He has not undergone professional dental education, and in our country especially, the awareness, if you know, is already very very less. So it becomes quite difficult for the patient to make quite difficult for the dentist to make the patient understand what problem he's suffering, what the treatment plans which are available, so on and so forth. Now we are slowly coming to the point why photography is actually important. So let's move on to the next point that the dentist has to deliver. The dentist wants to deliver the best treatment to the patient. However, what is the patient's mindset? The patient just wants to get rid of the issue. He is not really thinking about what treatment is required and stuff. He just wants that the dentist should rid him of all the problems that he has come to the dentist for. Now, the dentist is worried that the patient will come back to him, especially after you put the price. This is a worry that every dentist has. However, what is the patient thinking? The patient is worried if the dentist is duping him, if the treatment charges are very high, if he is an ethical dentist or a non-ethical dentist, if the patient is coming to you for the first time. These are all the worries in a normal patient that comes to or goes to any other place. Now, let's go back to the dentist. He is more worried that the patient will go to the dentist next door and that the dentist will do it for less cost. So what the dentist is actually thinking that probably he might go to the neighboring dentist and now you've already quoted a price, and what if the other dentist quotes a price which is lesser, or if the patient is bargaining with that dentist and the dentist agrees to do the treatment in a cost which is less than yours. So this is a common problem that all of us are facing at this point of time. There's bargaining everywhere. We've got to accept that this bargain is never going to stop. This is our Indian mentality and we've got to be happy with that. Now, what is going to be the turning point for the patient? What is going to be the turning point? How will you inculcate in the patient that even if your treatment is a little bit more expensive compared to your neighboring dentist, you got to give him reasons why he should not go to him, why he should come back to you only for the treatment. I have a question over here. Let me just take a look. Shrikant is saying, if there are not many participants in the session, I suggest you just touch upon the important points and conclude. Fine. There are a couple of participants, not an issue. Let's go back to the webinar. Okay, so the complete set of thoughts between the patient and the dentist is completely different. So we've got to understand the mindsets are completely different, and that is why we need to think about a way out. Now, what we understand over here is that the patients have never seen carefully in their mouth. When the patient is coming to a dentist, what they are actually thinking about is they are feeling something. Okay, they have a feeling that there is food lodgement. They have a feeling that there is pain. Now, the patient has never seen inside the mouth. In fact, every parent, especially in pediatric cases, every parent also fails to see what the child is suffering from. Probably the child is just telling the parent that, okay, I've got pain in such so and so reason, so and so quadrant of the mouth, but the parent probably can't see. The parent maximum, what the parent can maximum see is that there is a brown spot, and for that brown spot, the parent will come to a dentist, but they don't take a closer look. And probably a patient who is an adult, they usually do not see what is wrong inside their mouth. So this is where photography is going to actually help you. You can take a look in front of you. There is option number 1 and option number 2. Now, which one of these options would you think is actually going to help? Okay, there is one option on the left hand side with an orange box, and there's another option on the right hand side which has got a photograph. Okay, the patient is coming to a dentist, and the dentist is telling the patient, you have a lot of stains on the underside, or the patient will say the back side, or probably behind or inside. He'll use some word out of these, and he'll tell that you got a lot of stains on the underside of your teeth. Apart from that, you've got 3 cavities to be filled. Okay, this is the situation which is currently going on in our practice, which is option number 1. Over here, the patient is completely clueless. He just takes you for granted. Okay, probably the dentist is right. Probably the dentist is suggesting something, and why would the dentist lie? So probably he might agree or he might not agree, but he'll definitely be in a state of shock. Okay, I never knew that I had stains, but that is why he'll go for a second opinion. That's because you've not shown him anything. Let's go for option number 2. As soon as the patient comes into the clinic, the dentist does nothing but does proper cheek retraction. He puts an occlusal mirror in the patient's mouth and he takes a good picture with a DSLR. Now, this picture is transferred to a desktop or a mobile phone, and he shows it to the patient on the desktop or a tablet, whatever is comfortable for the dentist. As soon as this maxillary occlusal image is in front of the patient is already in a state of shock. And now, The patient is asking the dentist, "Is this picture mine?" That's usually the first question that I face in my practice. So of course the dentist will say, yes, this is of course your picture. Now the patient is going to start. The patient is going to starting to interact with you. The patient will say, "Oh my God, I did not know that I had so many stains." That will be the first reaction. Is these are these teeth mine really? So then you got to say, okay, these teeth are yours. Don't worry, these stains are there in all the patients. Probably you can say that there is little awareness about scaling and root planning in our country. So that holds true for everybody. Don't be in a state of shock. We can do cleaning for this. The patient will ask you what we can do for the stains. At that time, you can explain. Don't worry, we can go for supragingival scaling, which will take care of the stains. After that, the patient might probably ask you, okay, what are these brown spots? Will they go after cleaning? After that, you can say, okay, these spots are nothing but caries spots and they might not go during cleaning. If they don't go during cleaning, we'll use a caries indicator dye and find out how deep they are or if they are actually infective, progressive lesions and stuff like that. And then we can plan for a filling. So what is happening in these two options? Can you see the difference between option number one and option number two? Option number one is wherein you are not showing anything to the patient. You are just telling you have a lot of stains on the underside of your teeth and you've got 3 cavities to be filled. And option number two is you're showing the patient what the patient is suffering from. Now, which patient do you think might get convinced to undergo treatment with you? Now, this question is to the audience. I'll wait for a couple of seconds. Right. So most of the delegates, I think, have answered that the option number two is very, very beneficial. Now, do you think that this option number two is beneficial only to the patient or the dentist as well? Anyone? Both. Right. So why do you think that the option two is yes, basically for the treatment planning, for the treatment planning. So now you realized or probably now you understand how you can leverage this photography so that you can benefit out of it. Now I see not one but many benefits of dental photography and how you can leverage it. One major benefit was that the patient is directly going to ask you what is the treatment plan. Okay, so the patient, you can say that the patient is already convinced to undergo the treatment with you. The second thing is that explaining what we are going to do and how many teeth require that becomes very, very easy. That's because the patient is already seen. And as and when you do the treatment, you will of course be showing that you will be doing filling in probably 1/6 region or you will be doing a filling in probably 2/6 region. As and when you do the fillings, you got to show the after pictures also to them so that they can appreciate. Now, what will be the end result of this situation? Let me tell you that. He might go home. You can also probably email him the pictures. Now this is going to create a chain reaction. He's going to tell at least two other people that okay, this dentist is very, very good. I think he's very transparent, and if you have any problem, you can go to this dentist because I trust him completely. That's because he has shown me everything that he has done in his mouth. My previous dentist did not show me all these things. Now what happens is this, there is a communication of this patient with other patients, and then there is a chain of people coming to you. You will definitely get patients who will accept, who will appreciate the kind of treatment that you are giving them, and you should be very happy if you start getting quality patients. Yes, of course, the word of mouth becomes very, very obvious. It becomes very, very comfortable, and the chain starts spreading sooner than what we had thought of earlier. Now, sorry, in the option number one, if you think that the option number one was still very, very clear, you got to understand why should the patient trust you blindly. Of course the patient can't trust you blindly. So from today onwards, if you want to change your practice, start doing dental photography daily. Another reason why you got to do dental photography is that the patient has every right to see what they are really suffering from. If you are not showing them what they are suffering from, trust me, you are doing a crime. That's because it is our responsibility as of date to do evidence-based practice and show them what they are suffering from, so that even if they plan to shift to some other dentist, they have some evidence of what kind of treatment that we have planned for them or whatever treatment we have done for them. There'll be some evidence that you have to give to the patient why we have planned this treatment and why this treatment was actually done. So it becomes actually important to take up these pictures. Now we are all aware of various kinds of tests in dentistry. For example, there's vitality test, there's RVG. The patient has no idea of all these tests. For example, if there's a patient who has suffered a trauma in the upper anterior region a couple of years back, the patient did not have any problems for so many years, but since the past 1 month or so, he's complaining of discoloration. Do you think that if you say let's do a vitality test, the patient will understand? Now, I expect this answer from the audience. Do you think that the patient will actually understand what is a vitality test, especially when it took us a 1 year or more to understand ourselves in our colleges what is vitality test? Do you expect the patient to understand? No. But when we show the images to the patient, he'll appreciate very well in the images. Okay, fine. There's only discoloration in one tooth. Why there is no discoloration in other teeth? Then you can say probably you suffered trauma in this tooth only. That is why the tooth is going non-vital. And the proof of this is that that tooth is becoming grayish in coloration. This is very easy for the patient. That's because the patient can see. The images are going to speak for themselves, not the vitality test. The vitality test is of no use to the patient. That's because they have never heard of it. They will not even believe you that something like that which is existing. That's why we've got to take care of the pictures and we've got to show them the images. The biggest test for the patient is to see, if to appreciate what the dentist is telling, if they have some proof, if they can take something back home. If they have an image, they can show it to n number of people, and that image is going to build confidence in them to go for the right kind of treatment. So that's because with the help of this image, they are going to discuss it with n number of people in the family, what is right or wrong for them. Now what happens when you are giving them that image? What can happen? Probably they'll upload it on social media, right? Or probably they might show it to other people. Now think of the advantage of this. As soon as you give them an image, they're sharing it on social media or they'll show it to their peers, their friends or their family. Now there'll be an internal discussion or there'll be discussion online. Okay, there'll be somebody who will be saying, "Arey, ye to mujhe bhi tha, mujhe bhi hua tha." Then they will understand, or probably they'll go deeper into the discussion that okay, fine, I was suffering from this, then I got root canal done. Then he'll understand, okay, fine, the dentist also told me that the only solution to this is going for a root canal, and then we can go for a prosthesis. So probably the probably the patient did not come to you for root canal. When he came to you, he had a problem with discoloration, but you told him root canal. When you gave him the image, he discussed it with his family. They told that okay, they also had to go for a root canal. Then it is now that the patient has started developing confidence in you. So this is what is happening internally. The things that are not under your control also become positive when you have started doing dental photography and when you have started giving them images, or probably you can say when you have started evidence-based practice. Now this is actually an image of one of the patients that I had taken. Can you appreciate that 2-1 or the left central incisor is discolored? Now the patient had come to me for stains in all the teeth. I told him that the reasons for these are different. He could not understand why they are different. So what I did was I put a contraster behind. Now the black thing that's behind the teeth is not Photoshop. Okay, there's a special technique to take anterior shots, and that is by use of contraster. What is a contraster? How to use a contraster? We'll be discussing on 4th and 5th of July when I see you all in IDA Deccan branch. So as of now, we'll be discussing what I did with the patient. I just took this anterior shot, I put it in my desktop and I showed it to him. I just asked him one question: do you think all the teeth have the same color? Then he said no. He said, I think one of the tooth is looking dull and grayish, and he pointed out to 2-1. So I was like, yes, you are right. All the other teeth also have stains, but I think that probably you might have suffered some kind of trauma a couple of years back. in this tooth. That is why that tooth is becoming slowly non-vital and is changing its color. It hardly took me any time. That's because he only told me that this tooth is looking dead. I told him, yes, you are right. The only solution to this problem is that you go for a root canal, and then we go for a scaling for all the teeth. We'll see what all stains can be removed. Whatever stains can't be removed, probably we'll have to go for whitening, or probably if it's dental fluorosis, you might have to go for alternative kinds of treatment. That all we'll be discussing later. But as of now, if this is your chief complaint, if 2-1 is your chief complaint, let's start with the root canal. He completely agreed. Although he had come, the chief complaint of this patient was stains in all the teeth. But I soon realized that I think that this one was the tooth which was, affecting him probably mentally. It was giving a mental block, and that is why we started root canal of this. Trust me, until he saw this image, he could not make up his mind only that he had something like this. In fact, he had even forgotten that he had suffered trauma a couple of years back, or probably 10 years or 15 years down the line. He could not believe that after 15 years he is suffering from discoloration. I'm sure all of us must have had this kind of patient who is complaining of such things. All of us have had such kinds of trauma patient in which there's discoloration 15 years down the line or 10 years down the line. You just have to give them inspiration to go for the right kind of treatment, and the right way to go about doing is by showing them the right images by doing dental photography. Right. So I took the pictures, and then we started doing the root canal, and after everything was done, he was completely happy. Now this proves that the treatment protocol acceptance is better, and there is active participation of the patient. Do you agree that there is active participation of the patient during treatment planning? Yes or no? Great. So all of you agree that there is active participation of the treatment planning. This is why we call this particular way of treating or showing the patient what they are suffering from is actually called as active treatment planning protocol. It's called as active treatment planning protocol. Now this active treatment planning protocol can be done only by two ways. One is by showing them an RVG. If that RVG shows some periapical pathology, of course that is also going to lead to an active treatment planning protocol, because the patient can see or appreciate what the patient is suffering from. However, in RVG also there's some basic requirement of common sense and some amount of expertise. However, when you show them a photograph, that expertise is also not required. That's because the patient will definitely relate to the images that we have shown it to them, and the patient is himself going to ask you what we can do about that particular tooth. So this is what we call active treatment planning protocol. This basically increases the chances that the treatment acceptance is higher, and we are live one-on-one with the patient, and patient is actively telling you that we can go ahead with the treatment, and the patient is already convinced that some kind of treatment or some kind of invasive treatment is required in some particular case. So you got to understand these three terms. You got to remember what is active treatment planning protocol. We will be discussing about this protocol again when we come to Hyderabad on 4th and 5th. Now this kind of scenario is very, very common amongst pediatric patients that we face in our clinic. You can say probably this is a case of nursing bottle case. Why such things are, even in pedo cases, why these are very important? Because probably the parent has only come to you for the kind of swelling that they saw in the front region. Trust me on this, most of the parents might not have seen the posteriors. They might not have seen the posteriors, and probably because of this they have come to you for a boil. You've got to make them understand the intensity of the situation that the child is suffering from. You might start with the treatment planning for the anterior teeth. There is no denying of that, but it is your responsibility, apart from leveraging your practice, to show them what else the child is suffering from at that point of time, and that is possible only with good kind of dental photography. You put two cheek retractors and take only one picture so that the child patient is also comfortable. Just do that thing in one appointment. Don't do anything else. Show that picture to the parent, and I'm sure the parent will be shocked. Now this kind of picture is going to help you throughout all the appointments, so that you can sit with that parent and discuss the treatment planning of the entire mouth for this child. Now when you show this picture to the parent, you be rest assured that the parent will not go anywhere else. That's because it is the first time that any dentist has taken effort and shown him what the child is suffering from. Be rest assured that the child or the parent will not go anywhere else. In fact, even the child will be very conscious that he's suffering from so many cavities, and you can expect better cooperation from the child also. This thing happens only with good dental photography. So what kind of protocol do we follow for better treatment acceptance? Do we take photographs, all these photographs in the first appointment itself? Of course, there are a lot of protocols for doing dental photography. There's an AACD protocol, there is a UCLA protocol. What kind of protocol do we follow in the first appointment? I follow only one protocol. I follow only one protocol for this active treatment planning protocol. I follow only one protocol. I just take one picture on the first day, and that picture on the first day is the occlusal images. I'll just come to that slide. Yeah, these are the two most important images that are going to help you in the treatment planning of the patient. In the first appointment, just take two shots. One is the mandibular occlusal shot and one is the maxillary occlusal shot. These two images are the most important images for you as a dentist and also for the patient, is because the patients can relate very well to the occlusal surfaces of the teeth. I'm not too sure if you have noticed this in the patient, but the patient can relate to his teeth based on the occlusal anatomy. This is subconscious, probably inbuilt in humankind, and I feel that they can relate very well to the occlusal surfaces. So basically, these two images, they act like GPS for the dentist also and for the patient also. The patient can easily say, okay, this is my left side, and there's a big molar on the left side which requires this and this filling, and it becomes very easy for the dentist also to explain everything on the occlusal images. That is why the occlusal images are the most important images. That's because they act like GPS. So these are the two most important images that you've got to take in the first appointment. Now, do you need a DSLR for this purpose? If you have a DSLR, that's okay. If you don't have a DSLR, that is also fine. You can take occlusal images with any kind of camera. Unfortunately, an intraoral camera might not be able to help because they don't have a very wide angle of view. So probably you should have a digicam, or you can have a point and shoot camera or something like that, and use a good quality mirrors for occlusal view. Now, can you point out which is a good mirror for taking occlusal views? I need to know, do you do occlusal view photography at the first place? This question is to the delegates. Just wait for 5 more seconds. Right. So most of you are saying that some of you do it, some of you don't, some of you have never done it. So occlusal pictures are the most important pictures. So for the people who don't know about the mirrors, let me tell you, there are various kinds of occlusal mirrors available. Okay. Unfortunately, the most famous company out of them who supplies mirrors is Capri. Unfortunately, they are the worst mirrors available in the market. That's because they are double-sided mirrors, and they are back-coated mirrors, you can say. So they are not really great mirrors to be working with. For dental photography, there are special kinds of mirrors. You can say that there are full metal mirrors, or full stainless steel mirrors, or you can say front coated mirrors. These mirrors are very good for dental photography. That's because of something called as ghost images. Now, what are ghost images? What is a front surface coated mirror? What is a behind surface coated mirror? What is a double surface coated mirror? We'll be discussing in detail when I come to Hyderabad. So at this point of time, you want to understand or remember that a front coated occlusal mirror is very important for dental photography. I'll make sure that I'll get a couple of sets for all of you to see or use these kinds of mirrors when I'm coming to Hyderabad. So I hope I'll be seeing you all at that point of time as well when I'm coming over there. Okay, so we've already discussed why occlusal images are very easy. These occlusal images are basically GPS, and the patient can relate very easily to the occlusal images. Now, there's a rule of thumb about occlusal images. Honestly speaking, if you can't understand this at this point of time, it's completely fine. There's something called as flipping these images. That's because they are mirror images. So whenever you are showing it to the patient, you got to just flip them across in a photo editing software. That is one thing that you got to keep in mind. So this is how we leverage photography, and we create greater transparency in our dental practice, and this is how we can increase the conversions of our patients and actually make them our loyal patients, and see to it that the patient, although if they go to some other places, they can come back to us. That's because we are showing them even greater transparency, and they can trust us for the dental treatment that we are planning for them. Lastly, there are other ways in which you can leverage dental photography. One way is by creating your own data bank. Now, if you are not really very possessive about the data banks, what you can do is, after, of course, taking consent from the patient, you can submit these data banks to image stock companies. So even they can sell your images. It's a very good way of earning passive source of income. Now, it's not necessary that you sell these patient images only. You can also sell, various famous images. Like you can sell images of a mouth mirror probe. Now, these images are also in demand. That's because they can be used commercially. Now, these image stock photography is another big business. If you are actually serious about photography, you can do these. Secondly, there's one very important thing that you got to understand, that please don't download images from the internet. Those images belong to somebody else. They are copyrighted images. When you start taking pictures, and when you start building your own data bank, and when you start storing them properly, when you retrieve them correctly, you have got a good database, or you've got a good information about all your patients. Now you can use all these images yourself, so that you can use it in your website or social networking, so that you can promote your clinics happenings. You can actually put whatever you do every day, so that they are more, you can relate the patients to you on an everyday basis. Suppose if you have your own page on Facebook, your clinic page on Facebook, you can show them a good case that you did today. Your patient will also appreciate that what good quality your work you're doing for all of them. Of course, whenever you're sharing these images, you got to understand that you got to have consent for the patient. Without patient consent, you can't do anything. For instance, if I'm doing a cavity simple case wherein there is decay, then what I do is do the excavation. Then I'm using a caries indicator dye. Then what happens is that the patients, when they see all this in your Facebook page, even if they are not your patients, what happens is that if it's some other dentist patient, they'll ask you, okay, this stain probably was not used for me. What is that? Then we can explain to them that this is a caries indicator dye. What is it used for? The one thing leads to the other, and probably at that point of time they'll understand what is the worth of the treatment, or what is the worth of the fees that you are charging them. It is at that point of time that you actually start leveraging your practice, and you build up your practice. You can share these images for with them on social networking. You can make them understand or appreciate that you put in a lot of effort in making sure that the patient does not have any remaining decay, or whatever decay is left behind is not actually infected decay. You can also make them appreciate that whenever you do aesthetic fillings or composite fillings, you put in a lot of time and effort in doing good sculpting and stuff like that, and that is why your charges are reasonable. You can explain it. It's a very good way of explaining. In fact, even when you share this after taking the patient's consent, I'm very sure that the patient will be very proud of you, that you've done a great job. So this is one way of leveraging your photography, and one thing leads to the other, and there is better mouth to mouth publicity. Your patients will always compare, or somebody else's patients will always compare. They are constantly looking out at what the dentist has done. Now the markets are very competitive. Everything is out in the open. We've got to be aware of our social reputation also. Dental photography is the ultimate tool on how you can build the confidence in your patient, and how you can make them understand that you got a particular number of skills, and that you're giving them the best possible treatment. This is the highest level of transparency that you can achieve, and you can build the confidence in your patient. Ultimately, the patient is coming to you for a broad smile. They want to see a happy face. They, of course, don't want to get disappointed. When you are doing good work, it is your responsibility that you do good documentation and also share it with the patient. This is not only your responsibility, but is going to fetch you greater number of patients. Before we say goodbye, I just want to say, live your passion. Dentistry is your passion, live it completely, so that you don't regret it on the last day that you missed doing something. If you have a good case, if you've done a very good case, if you have not documented it, you will not regret if you've taken good pictures that, oh, fine, I did not do good documentation. But if you've done good documentation, it's going to be very, very easy for you, and then you can have great memories of the work that you've done. We'll see if we can conduct another webinar for you, probably on this and a couple of more topics like how you can leverage dental photography even more efficiently. As and when we plan the webinar, we'll be sending you the tickets for the same. Probably we'll be planning a webinar during this week itself. We'll not wait for the weekend, and we'll expect to get a greater crowd. And of course, I'll be able to see all of you in Hyderabad. In this webinar, I've put a handout for you. I don't know if you can check out the handout. There is one handout for you. It's called idadeccan.jpg. I'm sure you can download that. If you can't download that, I'll request the organizer to email it to you. It's a brochure about the fourth and fifth session, fourth and fifth workshop. Now, this workshop that I usually do on dental photography, when I do it at my place in Bombay, I charge 15,000 rupees for that. Now, IDA Deccan has come out with a great venture. It is doing at very, very subsidized rates. It is doing only for 2,500. Not only that, not only in these 2 days, for 2,500, you'll be learning complete dental photography, but also you'll be learning about rubber dam, complete use of rubber dam, achieving good isolation and stuff like that. So, do check out this brochure. You can forward it to your friends also if they wish to join. You can tell them that the rubber dam workshop and the dental photography workshop together is for 2,500. You can help Idea Deccan to get in more registrations if you think that is worth. If you want to contact me, these are my numbers. My number is 9920420317. If you want to write to me, there's another email that I wanted to give is dentalphotographyschool@gmail.com. The email in front of you is not working at this point of time. Contact@dentalphotographyschool.com is not working. Please write to me at dentalphotographyschool@gmail.com. That's my email address. Show off your skills. Let the photographs do the talking for you is my ultimate statement for today. I hope to see you when I come over there. Thank you very much for joining me today. Thank you so much.